thank you for joining us today. This is the Equal Hope Show on CAN TV. For those of you who are new, welcome. And for those of you who are returning, thanks again for joining us today. Equal Hope has a segment on CAN TV every fourth Tuesday of the month from 5 to 5:30. For those of you who have not heard of Equal Hope, we are a non-profit organization in Chicago, and what we do is we try to eliminate health disparities in Illinois by offering free services such as mammograms, cervical cancer screenings, assistance with vaccine appointments, and many, many more. Check us out on our website, equalhope.org, and we're also on social media. Also happy to announce that we have cancer support resources on equalhope.org. You can find some helpful handouts and links to different reputable cancer organizations and handouts that'll help you maintain your cancer, and also handouts for caregivers and providers. My name is Leilani Lacson. With us today is Dr. Lisa Green. She is the CEO and co-founder of Family Christian Health Center. Welcome, Dr. Green.
Oh, welcome. Thank you for having me.
Thank you for joining us. So, Family Christian Health Center has several locations in Harvey, Dalton, and Linwood. Before we delve into this month's topic, which is why it's important to have a primary care provider, let me provide our audience with just a little bit background information. Your health is one of the most important aspects of your life, if not the most important. But it can be easy to overlook, especially in times when you don't feel that anything is out of the ordinary. But poor health can limit certain parts of your life and stop you from doing the things you love to do. And sometimes there can be underlying problems affecting you, even if they don't cause any signs or symptoms. This is where a primary care physician or primary care provider, PCP, comes in. They are usually the first stop for medical care. The most important role of a primary care provider is to provide preventative care and keep patients from getting sick in the first place. The best preventative care means forming a relationship with a primary care provider and a team that you like and trust. So, Dr. Green, tell us about yourself and how you got into the medical field.
Oh, wow. So I had always, it's one of those things that actually story holds true for me, that I always wanted to be a doctor. I saw some shows on television, years ago. It wasn't Grey's Anatomy back then, but just the family doctor that was going out, had a pager and a bag, and was just, making sure the community was healthy and safe. And so I was like, that's what I'm going to do. I'm going to do that. My mom was like, okay, the first time she sees blood, that's going to be the end of that. But I became a volunteer in a hospital, and just got a chance to watch. And I was just wheeling patients around, but just being in that environment. But I decided that was what I actually really wanted to do. And so I ended up going to medical school, and then I came back here to Chicago because I went to medical school in Iowa. And then I came back and I did an internship at Chicago Osteopathic, but I completed a family medicine residency at Cook County. And it just solidified for me at the time that I was in the right field doing what I was supposed to do. Cook County here, which is now called Stroger, was a hospital open to everyone. And we saw people regardless to their background in so much need. And the sad part about it is because so many people didn't have insurance, things that were preventable, we would see the end stages of it because they wouldn't go until after it was the last case. And so that just embedded in me a drive and a passion to how do we do something on the front end, right? This treating people in the hospital, this can't be the answer, especially when we know that there's things that we can do. And so that led me and my partners to developing Family Christian Health Center. It was a way to take community health care to the people in the community before they needed a hospital.
Okay, great. Yeah, so I was going to ask you next to tell us a little bit about Family Christian Health Center and your mission.
So we are what's known as a federally qualified health center, which means that we are able to see people regardless of their ability to pay. It's a branch of the federal government that's based in the community that allows us to really be able to partner with our patients and bring comprehensive care to them. So our site, we opened in 2000, and the goal was to be able to minister the love of Christ to people, regardless of what their background was, about their religion. It took to everyone, right? And to do that in a safe way. I tell people all the time, we don't beat people over the head with the Bible. Our goal is just what does love look like? And so for us, love may look like, I don't have insurance today, or I've got a mental health issue, or I need help with family planning. What does that look like? And so we really want to drive into that and to empower people to be partners in their health. Because we saw one of my partners, she also trained, business partner, she trained at County with me. And we just saw the end stage of everything. And we wanted to be able to get in front of that, to empower people and to show them that they actually have a choice. They've got to say so in this partnership of health. And so that's been our mission, is to really reach back and partner with our patients to educate them, not preach to them, but be real to them about their health. And I think if you realize now, the last couple of years of COVID, I think it's taught all of us how important our health is, because it didn't matter, insured, uninsured, didn't matter, how many degrees you had. It's the vitality of having your health is paramount in everything that you do.
That's really great. And what would you say is your patient population? What are the demographics?
So our demographics are about 75% Medicaid, and that is people that have been on the exchange. And about 10% is Medicare, and about 20% is commercial insurance. Of that 70% that is Medicaid, what the exchange did, it opened up the window to allow people that actually work but don't have health insurance to be able to afford health insurance, which has been amazing, because people who had deferred maintenance for so long now get the opportunity to do that. But people find it difficult sometimes to get the resources and the care that they have when they are on Medicaid. And what we do is we try to remove those barriers and then allow people to get a comprehensive plan of care regardless to the health plan that they have. But even when people don't have insurance, we have what's called a sliding scale so that people can pay something, right? It may be $20. And the good news is we have a lab that's affiliated with us, so they could come in and see the doctor and then not have to pay for all the lab services that come with that. So again, trying to remove as many barriers as possible, getting people the actual care that they need.
Oh, that's really great. I mean, from experience, I know that labs can be really expensive, and even talking to a doctor for 5 minutes can cost someone so much money.
Oh, absolutely. Absolutely. And so people say, well, and that's the one thing that people will say all the time. I think about our doctors that actually spent time with them. They're like, oh my God, I've gone places when I did have insurance and, had to pay X amount of dollars. I was only in the room for like 5 minutes. And that experience sometimes will let people say, well, you know what, I can wait for that because I'm not going to spend, that money. And I think that now those critical choices with things happening the way they are now, with gas prices, with just everything going up, people unfortunately have to weigh their health versus some of their other items that they need on a daily basis. And so I'm very grateful that we have an environment that allows people to get access to the doctor and care. And we also have what is called Navigators, and those are people that it takes some of the guests out, and they actually sit down with you and help you walk through and get health insurance.
That's really helpful. We have Navigators at Equal Hope, but it's to help women who want to get a mammogram go through the process of making an appointment, making follow-up appointments, someone to go with them, just to make the process easier, because a lot of my colleagues say that, if they didn't have us, then more than likely they wouldn't go to a doctor because there's too much, paperwork, there's the middleman. So it's really great that your organization is giving everyone an opportunity to seek the medical care that they need and should have. Okay.
Yeah, no, and especially when you look at prevention. I know we'll get to that later because there's so many things that we can screen for on the front end, but cost is such a big factor for people and the complications that they just kind of roll the dice a little bit because if I'm not feeling it, it's not falling apart, I think I'm okay, I'm good. But there's so many things that we can do regardless of what you feel or see. But again, we can't do that until you actually come in.
So what is a medical home and why is this important for people?
Oh, a medical home is a physician's office that you establish a relationship with, meaning that you find a doctor that you trust, that you feel, confident in, that you can talk to, someone that you feel that can listen to you. And that person, once you develop that relationship between you and that doctor, then that allows you to come along with the other items that are support services. That is, you have a home now that if you need lab services, if you ever get admitted to the hospital and you need to get admitted to the hospital, if you find that you need referrals to other subspecialists, they can help you navigate through that. If you find that you need mental health issues that you need to get addressed, they can help with that. They can help with social services. If someone's elderly, they can help with finding placement, home, food. There's so many things that come with that. It's like an umbrella of care once you identify a site and a relationship that you trust. And that's extremely important because they know you. They get to know you, even as far as big as practices are. They know Miss Jones who comes in on a regular basis, or Miss Jones, nope, I'm only doing twice a year. That's all you're gonna get me here for. But you know Miss Jones, you know where she works, you know the things that are challenges for her. And so it helps the physician to be able to provide better care. It's no different than if you have a really good friend, like who, if she does something out of the norm for her, you're like, well, wait a minute. I know she usually calls me every day at 9 o'clock, but I haven't heard from her in 3 or 4 days at 9 o'clock. Something's wrong. I mean, that's, one extreme, but it's something as simple as, you know what, Mrs. Jones came in today and her blood pressure was 200 over 100. That's not normal for her. So what's going on? How do I dig and find that information out? And it is very different from someone that just, you pop into the emergency room. They don't have a relationship. They don't know if this is your norm, not norm. They don't know all the other factors. They don't know any of your blood work. They don't know any of your family history. They can elicit all of that at the time. But it's such a better environment of care when you've established that, because then you can focus to what we call the root cause and begin to look through to find out, what is actually at the root of the problem.
So a medical home is pretty much like a one-stop shop for all the things that you need. And if you can't get what you need in this one place, you'll be referred to outside of the umbrella.
Absolutely. And it's usually outside people that your medical home provider has a relationship with. So even though it's outside that facility, it's kind of in a network. And that's what it is. It's that network of people that allow you to get the care that you need.
Perfect. So when I was doing research for this show, I learned that there isn't only one type of primary care provider. I used to associate it with an internist or GP. So tell us about the different types of primary care providers that are out there.
Right. So internal medicine is a general practice. Is internal medicine, someone who takes care of adults. That's between the ages of 18 until 100, to 120, however long that someone's blessed to live. And they span that range. But there's some people that are internal medicine peds physicians that can be a primary care physicians. And those people happen to be doctors that are board certified in both. They do pediatrics and they do adults. And so that means they can take care from infancy until the end of life. But then there's sometimes that people's primary care physician, if women of childbearing age, they may see an OB-GYN and they see that as their primary care physician. However, they still need to have a relationship with someone that does the primary care to help rule out any other problems that could be existing. For example, you have a young woman and she's just coming in for birth control, right? So she can go to an OB-GYN to get that. However, she still needs someone that eventually does that screening for hypertension, for diabetes, for cholesterol, all the other components that we watch and look out for and do screening. So therein lies the difference. And so some people feel like, well, I'm just focusing on my kids and I only, need to see an OB-GYN. But most OB-GYNs will also help you establish and co-partner with you a primary care physician who addresses all the other health issues, and then they share the responsibility of ensuring that you get a comprehensive plan of care.
So it's pretty much teamwork.
It's teamwork.
So can you give us examples of what services a primary care provider can provide and examples of services that they are unable to provide in clinic?
So a primary care physician, say someone is 30 years old and they've been struggling they think they have asthma, they can't breathe, right? That primary care physician, they could go in for the visit. They will get a complete physical, but then they will get blood work. They will get blood work to look for any things that could be causing that. They can do testing to see if the person has asthma. Sometimes they require a chest x-ray that they'll have to write an order for. Sometimes they may need to order an EKG, which is another diagnostic test that we use. Sometimes, and again, the x-ray will tell us, if there's other issues that we need to address. And so most primary care physicians can do the initial exam, initial blood work, and then some simple testing that they do in the office. They can screen for diabetes in the office. They can check your pulse ox, which means to see what your oxygen level is like. Some offices are equipped that if they think it's an issue with the heart, they can do an EKG in the office. They can do a urinalysis in the office. But more importantly, if there's any test that they think that they need to do outside of that, they usually have a referral network that they can refer you to. And sometimes it's in the same building, sometimes it's just on another floor, or sometimes it's across the street. But a lot of the initial care can be done. What they don't do, however, is acute chest pain, acute shortness of breath, acute abdominal pain. Things that can be life-threatening, those things we always have people seen in the emergency room so that they can get an evaluation to ensure that nothing is life-threatening. If all those things have been ruled out and the patient is safe to be discharged home, then they will follow up with their primary care physician. If things are not and they need more acute attention, then people are admitted to the hospital where they can get a closer look and monitoring until they can get to the root of the problem.
Okay, great explanation on that. So, how often should someone see a primary care provider?
So if someone is otherwise healthy and has has no medical problems whatsoever, a once a year annual exam is good, right? Because then you come in once a year and you're able to get a head to toe physical conversations, because we're checking mental and physical, so we do screenings for depression, screenings for anxiety right now. And then we go over risk factors, whether that's smoking, whether that's drinking, whether you are socially isolated. All of those things are addressed. And then we get a good family history, a good surgical history. All of those things are addressed in that initial physical exam once a year. And in case someone needs preventative shots, preventative testing, if it's a female and they need a pap smear and a mammogram, if it's a male and they need a prostate exam. But it changes as we get older. So there's certain tests that we screen for, like we're not going to give a 20-year-old a mammogram, right? Unless they have a family history of something that we need to do further. But for the most part, they're tailored by male, female, and then by the age of the individual. But again, it's having that conversation. And so sometimes, for example, if we do a screening for people that have to rule out colon cancer. Well, that doesn't happen to 50. But some people at 50 are like, oh, can you give me another year, Dr. Green? I'm not ready for that yet, right? But what you do is then you sit down and it gives you an opportunity not just to do the exams or offer them, but to really explain why they're important and what you're looking for. Because that's the one thing I think that we get so much. Social media is amazing for information, right? But I think there's still value in that face-to-face relationship with a primary care physician that knows you and that can help explain questions that you might have.
So I was going to ask you next, for people out there who've never been to a primary care physician, can you walk us through what typically happens during this first visit and things that the patient should discuss with this doctor offhand?
Oh, absolutely. So the first step is making the appointment. Let's say that for someone who hasn't. That is the first step. And that is either, on the telephone, people, you can do it online in certain places, and then getting the information that they'll ask for you what insurance that you have. So that way it helps them know if it's covered there and what other kind of testing, if they need to order something, what their choices are for the test that they may need to order. So initially, then once the appointment date comes and you arrive at the clinic, the first thing they do is they will verify that the information that you gave is true, because in this day and age, we really have to protect patients' information. So they want to make sure that this is you who called on the phone. So we need ID to verify. And sometimes people get frustrated because they're like, wait a minute, I did all that on the phone, so why am I doing it now?
Yeah.
It's really a protection for you. Then after that, what happens is you're usually greeted by a medical assistant or support staff who then brings you back into the room. When you come into the room that time, what they initially do is ask a bunch of health screening questions. So there are these questionnaires that they may ask you to fill out about depression, about anxiety, about the type of food that you eat, the exercise that you do, any family history, any work stress. Have you been in any accidents before? Have you had any surgeries before? Are you allergic to anything that you know of? Does a family member have allergies? Have you been in the hospital before? It sounds like a lot of information, but what it's doing is allowing the doctor a snapshot of who you are, right? And so after that information is given, and some people will have a form that they can fill that out before they actually get into the office. Once that's done, then the doctor takes the time and kind of goes through that and said, oh, okay, you know what, Miss Hope, I see that your mom had, diabetes, but I also see that you really like Pepsi, 3-4 cans a day. Do you realize some of the association? And it's not to blame, point fingers, it's to educate and empower. Right? That's the whole goal, is getting the information, is to educate and empower people with making wise choices in their health. And so after that phase of going through the questions and answers with the provider and the patient, then what happens is they will start a physical exam. That is head to toe. But remember, the exam starts when the doctor walks in the room. So when I walk in the room, I can see how you're sitting, how your facial expression. I'm looking at everything how you write. If you get up and walk across the room. So part of that analytics is going on the entire conversation. If you are sad, if you are withdrawn, if you are tearful, if you are anxious, we're beginning to see that kind of assessment in the room. Again, not judgmental, but helping form a picture of what your concerns may be. And so then after that, what happens is we do a head to toe physical. We will look in your eyes, your nose, your throat. Even with COVID, I have the patients take the mask down, because we all have masks and eye gear on. And so I take a look in their nose. Take a look in their mouth. I am making sure that I don't feel any lymph nodes. Listen to their heart, their lungs, checking their abdomen out, which is the stomach area, looking at their knees, checking their muscle strength. That gives me an idea of an overall kind of general health. But then the next step is, depending upon their age, is when I do blood work. I want to check to see that they're not anemic. I want to check to see, depending upon their age, what their cholesterol is like, what their kidney function is like, liver, all of those things that you cannot see. The reason that people go to the doctor when they don't have insurance sometimes say, I'm good, I'm not having any problems, I feel good, yeah. I'm solid. But the issue is you really can't tell or see that, right? And so we tend to blow off a lot of things until we can't anymore when insurance is an issue and a barrier for us. And so after that time, the lab orders are given. And if someone requires blood work that needs to be fasting, that's when we inform them and say, you know what, because people say, well, can I get the blood work done today? And it needs to be done on a 12-hour fast. So we have people to not eat after 10 p.m. and then come back the next day. Sometimes if we know that they're going to need that beforehand, we will inform them before their appointment. But after that, we then tell people, if for example, if you need a pap smear that day, that, are you okay with us doing a pap smear? if there's any other screenings that we need to do and schedule. And that's the time that we kind of go through those. And then we tell people one of two things: either they can come back for a visit, or sometimes we can call them back for their test results. Now, with all the technology, people get their test results back given electronically a lot of times, and then they get the information. But people, we find a lot of times people who haven't gone to the doctor, and then when they finally go and they get their blood work, they become very anxious, right? They were good, but now they have the insurance. And so what we want to do is to remove some of that anxiety out, and really then, as soon as we get the results back, taking the time and going over the results with people so that they are not on WebMD and through the internet, trying to find out. So, and we all do it, right? We all do it and look up on information. Yeah. Information is power. It's great, right?
Yeah.
But at the same time, it's a better deal when you have the information and you have a trained professional that develops a relationship with you that you can go over that information with.
What are a few reasons that people say about why they don't want to go to their doctor every year for an exam, or why they don't sign up to actually have a primary care provider?
Some is, I don't trust the person. Bad experience. If they've had a bad experience with someone that they went to see a doctor and the doctor they didn't feel the doctor listened to them, it was a waste of money and a waste of time. And they made poor eye contact and didn't tell them anything. And so when people have an experience like that, and they're like, you know what, I'm done. I'll be okay. I'll just go if I have to go. Sometimes people don't go. Unfortunately, though, when they actually have serious things that are going on because of fear.
Fair.
Fear blocks a lot of people, and especially women that are in the shower or something and they find a lump. And it's unfortunate that I have had several patients that the lump has been there for months, weeks, and they just didn't go because of fear, because it's that fear of the unknown. And what does that mean? And so that fear then leads to denial, and it stops people from going several times. And again, if they don't feel like there's someone that they can go to, that they can trust, that, and again, cost comes in. If they're insured or underinsured, and they may have insurance, but they may say, but oh my God, if something's really wrong, my copays are going to cost this. I can't afford that. I just got, a new apartment, or I just got this. So let me buy some time. So I'm going to drink ginger, and I'm going to drink turmeric tea, and all those things are good, because I am definitely a believer in naturopathic medicine. Right. And all those are good, but they don't replace a conversation with reality of information that pertains to you. So you get it, and you can't begin to even heal, whether that's to remove the anxiety or to get access to where you need help when that fear comes. But it locks people, and it paralyzes them. And they'll say a lot of times, I knew I should have been here. We do the same thing because we provide dental care. And when we come in to see a doctor, we have patients that come in and they begin to apologize. And they say, you know what, Dr. Green, I'm so sorry. Let me tell you before you look at my mouth that I don't have dental insurance. I haven't been to the dentist, but I have been trying to do. And it's, for people, that embarrassment is there. And so I think there are so many other factors that, the cost, the fear, that immobilize people. And then they think there's always the next. Well, I'll do it next month. Well, I'll do it next, year. Yeah. Well, I do it when I get another job. Well, I'm only 25 right now. I can wait another. And then they wake up, and that next has allowed something that was small, that could have been controlled, to now have more control. And they lose that control and ability to be able to navigate through a system that actually was built to help. But unfortunately, there are people that have had bad experiences, or family members that have had bad experiences. And that leaves a sour taste for people. They're like, look, the person was not good, and they didn't get the best care, and I'd rather just wait.
Great. So what advice, quickly, do you have for people who don't have a PCP?
Find a PCP. It is the most important thing that you can do in your life, is to find a primary care physician that you trust, that you feel confident with, that you can build a relationship with, because tomorrow isn't always promised. And at the same time, it gives you an opportunity to be prepared. You know, we buy life insurance, we buy car insurance for our cars. You know, we don't wait till the car goes on completely E. We put gas in that car before it goes to complete E. Having a primary care physician is making sure that you got gas in the car, so that when you need to go and you need to find something and you need to navigate through, that you have someone that's going to help navigate with you. And so that is the key, is finding someone that you trust, that you can talk to, that you feel that's reliable. And if you have one bad experience, don't stop there. Don't stop until you get someone that is able to partner with you to ensure that you have a relationship with somebody to provide the best care possible. And it's for you, your family, and your loved ones. And you deserve it.
Okay, great. Thank you, Dr. Green, for joining us. Well, that's all the time that we have today. Join us next month on the fourth Tuesday of the month. Thank you.